So hello everyone. Hello Sir Immersion. We are DigiWeb. Our topic is Psychotalk, a non-profit volunteer psychologist to provide proactive anxiety and depression therapy application. So the members is Castaldo Gerald, Magbuo Gio, Hitachi Jamari, and Villegas Angelica. The table of contents are background of study, conceptual framework, statement of the objectives, significance of the study, and scope limitation. Also, related to literature, research design, source of data, instrumentation and data collection, also development tools. Our first discussion is the background of the study.
So for the background of organization, the name of our organization is InTouch Community Services. So InTouch was founded in 1980 as a non-profit and non-government organization. Many volunteers who keep in touch are trained in responding to crisis lines. So InTouch is one of the few that focuses on mental and emotional well-being. So next slide. For the background of our study, depression should be a concern that we'll consider an important mental health issue. Should focus on we also need to take care of our mind and body. Avoid that makes you lonely nor sad. So because many people are now experiencing depression and anxiety, they need someone to talk to and others need a licensed psychologist to give them a therapy. So next. So, when a client has depression, anxiety, or other mental problems, psychologists can read about the conduct of the individual. So, a psychologist must first assess what behavior a client has before giving a advice or therapy. Next slide.
The conceptual framework is the organization in touch community service admin has access to the dashboard psychologist data and clients data. And the database gathered the data including the assessment, data of the client, and the mobile application. In mobile application, it has the feature of assessment, chatbot, online session, emergency call. The assessment is the question provided for the client to answer before signing in to the application to identify their level of anxiety and depression. The psychologist has access to the client through online session, emergency call, and also the database. The online session can be requested by the client with the use of a mobile application. The chatbot can be accessed by the client to have a conversation with the artificial intelligence AI to acknowledge their presence by having a friendly chat to acknowledge their presence. The emergency call can be accessed by the client with the psychologist if they are needing urgent assistance for their situations. And next slide, please. The sign I in the statement of the objectives, our application is designed to help clients who are suffering from anxiety and depression that is lack of financial to get a therapy from a psychologist. And these are the following features. First, the chatbot. The system has a chatbot for the client to have a conversation with AI to provide a friendly conversation for them to feel heard. Next, the online session. The system has an online session for the clients who wants to make a video call or session to a psychologist. Assessment, the system will provide questionnaires for them to answer to identify which level of anxiety and depression they are experiencing emergency call, the system has an emergency call for the clients to have an urgent response for their situations. Next slide, please. Significance of the study. The clients will benefit in this study as it is convenient for them to seek aid from a psychologist to provide therapy on them as they can exchange data and their data privacy will remain confidential. Next, the volunteer psychologists will benefit from the study by having access to the patient report progress and having an organized schedule appointment. For the organization in touch community service, the organization will benefit from the study as they can access the database of the application and the psychologist data. For the future researchers, they will benefit from the study as they can get necessary data to compare future studies regarding in our topic. And last, for the society, they will benefit in a way that the people who are suffering from anxiety and depression can use this application to seek aid from the professionals. Next slide.
So scope and limitation. So the scope is established before the starting of the study, and the limitation is describing after the completing our study. So first is the study will focus on the clients who are having anxiety and depression. This describes that it will not focus on the other mental health issues. This will focus specifically in anxiety and depression. So second is the study is developed for the organization ITCS or In Touch Community Service. So this application will use it in touch community service to help other people to uh, exclude their anxiety and depression. So third is the study will provide psychotherapy and by the psychologist. So this study will provide some therapy for the legitimate psychologist to make sure the alliance is comfortable and more efficient for the therapy. So fourth is this study will only include licensed psychologists to ensure effect. Yes, just like what I said earlier. The study will provide some licensed psychologists to ensure the therapy is well provide, uh, well ensure the therapy is good. So this will affect more on the clients. So the limitation of the study. So first is it will not focus on the clients who are having other mental disorder. Again, just like what I said earlier, it will focus specifically on this anxiety and depression. So for this app. Next is the study will not focus on the client prescribed medication as it will provide only psychotherapy. So the study is only, or the app is only provide some therapies. The psychologist is uh, licensed to therapy, not to prescribe some medications. The license who can prescribe some medication for this kind of mental disorder is psychiatrist. So psychologist is on only therapy they can provide. So next.
So this chapter present nine apps related to our study, also to improve our creative application to enhance learning of this study. So the depression and anxiety are one of the most usual application in the world. It is said that many have been experiencing this type of issue since then. Most of the organization connected to mental health, they use cognitive behavior therapy. So here are the application to help them. So first is the mind notes, and next is the Oratu. Next is the Brahat tense therapy. Next is the mood trainer. Next is feel stress free. Next is the Uber. Next is the happy feel psycho education. And last is the Sulky. So first is the mind notes. So helps our client has a depression and anxiety. They see the changes on the person who suffer this kind of illness, at their point of view to chase down some assistance that will happen to some online program for different people, and to meet an expert psychologist to help them. Next is next is the Eratu. Eratu is same in the mind notes. It has a app therapy, but Eratu has a um, emergency call to prevent suicidal or etc. Next is the Rehaltens therapy. This app is has a chatbot are using completely automated kind of IMS, IMS, IMIS. It is possible for a chatbot to have discussion with a human person using the script. Um, this chatbot might help to extend the healthcare services for the clients having a anxiety and depression. Next is the mood trainer. The mood trainer is enhance the client having a anxiety and depression to a good mood and prevent uh, uh, suicide or something bad to their health, and to educate the client. Next is the feel stress free. The feel stress free is the have a meditation music to relax the mind of the client, and and to stress free um, the feel stress free to uh, having a also having a tactics to uh, to to feel stress free. Also next is the Uper. The Uper is the self-guided intervention app for emotional illness, and it used to empirically proven treatment for anxiety and depression to improve the user emotion, to manage it. Also the emotional regulation tactics. Uh, it used to before the anxiety and depression treatment protocols, the adoption of the therapies to help a user manage emotionally. Next is the Happy Feet, Happy Feet Psycho Education. This app helps the client and the family member to how handle the client have a anxiety and depression, and also to educate some uh, tips to guide the client. And lastly, the app is Lusog Isip. Lusog Isip is uh, one of the first app of the Philippines in a mental health uh, provided provided of the Philippines. It is checked by the World Organization. The Sukisip is up, up ask user to score their current well-being and they're copying the mechanism. The app also gives a list of the local mental health and psychosocial support services. Um, Also, the app has a self-help option and um, has a meditation and mood training for the client having a depression anxiety. And that's all.
Next slide. So research design, the strategy and overall framework of the study. First is prepare and locate, categorize, inspect. Third is design. Fourth is perform. And lastly, manage, observe, and report. So research design, we conduct a study in touch community service to help us to know about more on clients on having some anxiety and depression and the way they're how they help by the psychologists. So we able to collect some data from the InTouch community service and with the psychology itself. So we also collected the data from the other psychologists to help out this study to know the best solution or best features to have an effective and well use of this app. So next next slide. So the Scrum framework. So Scrum is a type of project that is often used by the software developers or by us. So this kind of model helps us to reduce some risk things like scopes, resource allocation, or use of schedule and testing. So Scrum project is help us to well use this paper and helps us to develop to follow those set of rules. And the Scrum is consists of the following. And the first is product backlog. The second is sprint planning, and third is sprint. Uh, this is by the daily scrum, sprint backlog, sprint retro, sprint review, stakeholders, potential deliverable product. That's it. Next.
For the source of data, the researchers conducted an interviews with the primary source of the study, like psychologists of the InTouch community services. So the developers the researchers are looking for data on how a person with anxiety and depression can recover. So next slide. For instrumentation and data collection, first interview, the researchers conduct a question sheet in order to obtain information of their psychology. The researchers gather information on anxiety, depression accommodated by psychology in an organization. Second is observation. The researchers collected information by asking the psychology of a past interviewee for data on anxiety and depression. Last, online research. The researchers utilized the internet to get information from research papers that are relevant to our study. Next slide.
Admin tools, mobile application. We are going to use mobile application. It is a software application that is intended to operate on mobile applications, a mobile device such as a smartphone or tablet. And next is the wireframe. It is used to design a mobile application. It is typically used to demonstrate the layout at, as well as the content functionality of the mobile application. Next is the web application, a program that is stored on a distant server and transmitted via internet to a program interface. Next is the data flow diagram. It is used to illustrate what will be the process of the system graphically. And the last is the machine learning. It is an artificial intelligence to improve the accuracy of software application when it comes to forecasting the future outcomes. And that's all. Thank you for listening.